We're talking today about the use of cannabis in a patient who may already have a liver condition or where there's concerns of a liver condition developing after the use or the start of a cannabis product. First, let's lay some groundwork. The liver is an incredibly important organ in the body of all mammals, both our dog, cats, horses, as well as human patients. When your healthcare provider evaluates the health of liver, whether that be a dog or cat or in your own health as a human patient, one of the things that your provider will look for is how well is the liver doing its job? Is it effectively being the filter for the rest of the body? Is it doing a good job in its role in digestion, so producing the bile acids that are important in processing all the food that we intake? There are several parameters that we can use from a clinical perspective to evaluate how healthy or how functional the liver is. There are some values on just a routine chemistry panel that we can get from drawing a little bit of blood, spinning that down and running for those values that give us a good idea, at least, of what's going on with the liver. I've listed a couple of them for you below, but the two that you'll see most commonly and hear most commonly talked about are ALP and ALT. Now, these two values are really interesting because they fluctuate quite a lot, actually. And just because one of them is elevated does not automatically mean the liver is in trouble. However, it does mean that we may want to pay more attention to what's going on in that organ so that we can intervene later if necessary. Let's talk first about ALP. This is a value that is quite commonly elevated in conditions that are actually outside the liver. So we can see this go up in GI disease, we can see it go up in dental disease, we can see it go up in some forms of cancer or bone conditions. So again, just because that ALP value has elevated over time doesn't automatically mean that there is a dire process going on, but it does indicate we might need to look further. One of the things that's interesting about ALP is that it does shift over time. It is a value that one instance of it being elevated is noteworthy, but we really want to see a trend over a period of months to be able to identify what's actually happening in the liver itself. There's some really interesting research in specifically dogs when on a cannabis product that when we see this ALP value increase steadily over time. Now, in these research studies, if that value of ALP was within 2 times the normal limit, so from the lower limit, higher limit, 2 times that, anywhere in that range, it was really considered clinically insignificant. Doesn't mean we don't watch for it to change, or if it goes higher, evaluate more. But whenever it's in that range, currently we don't consider there to be a clinical problem with the liver. There's a few other values that we can monitor on a chemistry panel. So ALT being one, GGT being another. What all these do is give us more specific information about what might be going on in the liver. However, these values that we can find from a chemistry panel may not be as informative as we need them to be. So if we consistently see an ALP elevation over time, one thing that your healthcare provider might recommend is that we go further and do an additional test that's called a bile acid assay. While the chemistry panel tells us more about the enzymes that are being released from those liver cells or what's going on in the liver as a whole, it doesn't tell us that much about, is the liver still able to do its job? That functional test is really what we look for from the bile acid assay. Bile acids are secreted by the liver, stored in the gallbladder, and then used by the body in digestion. Once they are in the intestinal tract, they are, most of them, reabsorbed back into the liver and recycled, so the body is very efficient in that way. Some of them are passed out through the feces, but if the liver is functioning really well, we'll see a large majority of them be recycled. If the liver is not functioning normally, we may see an increased level of these bile acids in the blood because the liver is not actually filtering them out like it should to be able to recycle. So a bile acid assay gives us more information than just the standard chemistry panel, and it allows us to say, liver, are you functioning like you should? Can you still do your job? And how well are you still doing that job? So frequently, when we see an animal that, again, either has ALP elevation to begin with or develops ALP over the course of their cannabis product administration, adding in a bile acid test is a really good way for us to get that little bit of extra information. So that lets us look at the functional health of the liver. Then we can also use an abdominal ultrasound to evaluate the structural health of the liver. By using the ultrasound, we can go in and look for actual nodules, blockages, there may be cancer in the liver, things that we may not be able to see on a functional test, but we can absolutely see with a structural evaluation. Now, usually the abdominal ultrasound, we wait to implement until we actually see an abnormal bile acid test. So we actually do have a pretty good spectrum of diagnostics and treatments that we can implement over the course of a period of time the animal's receiving the cannabis product. It's not necessarily necessary to do them all at once, but it is a good idea to have a conversation between you as the pet parent and your veterinary healthcare team to sort of lay out a plan of how you're going to make sure that our pets are safe when receiving a cannabis product. When you think about using cannabis in an animal who already has liver enzyme elevation, so we start out with a chemistry panel, a baseline, and we see, oh, well, there's something going on with the liver, but we're not entirely sure what it is. Inflammation that may be a part of most liver conditions is actually improved by the use of these outside cannabinoid molecules. Some of the terpenes can be really beneficial here. So we may actually see those liver values come down over time when the animal starts off with an abnormal liver panel. That continued monitoring in an animal that already has a liver condition is very important because we want to make sure that we're not doing harm and actually seeing improvement over time. So these consistent monitoring, maybe including a bile acid or abdominal ultrasound, it's probably already part of your veterinarian's treatment plan or diagnostic plan for the animal, but even more important to continue it and stay on it when you're using a cannabis product. Now, in the scenario where we have an animal who was normal on their chemistry panel to begin with, and then after using a cannabis product, we see some elevation, usually an ALP, that's the time when your veterinary professional is probably going to recommend that we continue to monitor with a chemistry panel, may add in a bile acid test, and may also recommend an abdominal ultrasound. And that really comes down to the patient, the pet family decision, and then your veterinary healthcare team all working together to find an ideal plan. If that value of ALP, again, usually is when we're talking about, continues to rise or stay elevated, it's not coming back down to where we want it to be, that may be a time to reevaluate the product or the cannabis product that we're using. We can see additives, residual solvents, pesticides, so in contaminants in the product itself that may be contributing to this elevated value. We can also see a mismatch between what that cannabis profile, the molecules that are in that product, it may not be the right match for this particular case. For instance, we frequently see this elevation in animals who are being given a CBD dominant product. We may find that we just have more CBD in that product than we need, and so the liver is actually having to do extra work that it doesn't have to. So we may change the ratio of molecules in the cannabis product to find one that exactly fits what that patient needs. Again, none of these are scary or concerning as long as you and your veterinary healthcare team are working together to find a plan that fits that specific animal. Whenever we come to a place that we maybe want to take the animal off cannabis, that's fine too. A really great way to see if this liver enzyme elevation is due to a cannabis product is to remove that product, evaluate the enzymes over a period of time, and see if they come up or down. And a lot of times we find that they were just going up on their own with or without the cannabis product, and we know that there's some other condition in the body that we need to look for. So there's lots and lots of ways to manage these types of concerns, but I think the biggest thing that I'd like everyone to get from this little short overview video is that liver enzyme elevation is quite common in cannabis patients, whether they be veterinary or human, but we are finding out through research that it's not automatically a huge concern. It is something that we need to chart over time, and we definitely need more research into what's going on in these hepatic cells, but it doesn't mean that we have to take the patient off cannabis. We just need to be monitoring really carefully. So I've put some more detail about this topic in the written portion below. And if you still have concerns or your healthcare practitioner has some questions, please reach out. We can definitely go into this in more detail. Schedule a consult if that's the information you're looking for. Some of the articles that we've included in this module are also available. There is lots of information out there, but we are still learning, and we want to make sure that we are doing no harm first, and then absolutely helping our patients have access to good products, good safe cannabis products that are not going to complicate any underlying issues.